So there is so much to talk about with coronavirus. That's why 9 News health expert Dr. Payal Kohli is back with us today. And I think we're all fascinated with what we know, but maybe more so with what we don't know at this point. Do you think that there is a blueprint we can look at to understand what is coronavirus and where it's headed?
Well, you know, the coronavirus is about 75 to 80% identical to the SARS virus. So the SARS epidemic really taught us a lot about what we can do differently here with coronavirus. But things have evolved a little bit, and we have actually gotten a little bit past what we were with the SARS epidemic. So the number of mortalities or deaths as a result of this virus has increased compared to what it was with SARS. So I would say we're a little bit in a data-free zone, but certainly we're taking a lot of our blueprint from what we did with the SARS virus.
Well, we see now what's happening as far as its spread. It was very much Wuhan-centric. It started to spread more in China and Asia. Now we're talking about Italy and South Korea and other places. What about the United States? Is there an inevitability that it comes here?
Well, the United States is certainly at risk, but I would say at this point our risk is still relatively low compared to other countries. The things that make us at risk is the fact that U.S. citizens travel all over the world. And one of the biggest ways that the virus has spread is through direct human-to-human contact respiratory secretions. So it's hard to limit people's travel, and it's hard to know exactly where it's going to end up. And so I think that's one of the biggest risk factors for the United States moving forward. But at this point, we still only have a handful of cases, only about 14 new cases, and the rest that came over from the Princess cruise ship, with only 2 cases actually being person-to-person transmission. So as far as we can tell, it's still, traveling outside the country is really the way that you're getting the coronavirus.
It's funny because people talk about a fast track of a vaccine and then talking about a fast track being 18 months. It's not going to happen overnight. No,
in fact, the fast track for this vaccine has to be a lot shorter than that. And then the vaccine that's kind of being tested right now is very promising. But I think that to answer your earlier question, would really be the next step in terms of containing the spread of this virus, because it is very difficult to limit large populations from traveling and from interacting. But the scientists at the NIH are really expediting the development and the release of a vaccine. So hopefully we'll have that soon.
We see people traveling with the masks. Is the mask actually an effective way of reducing spread?
The masks have sold out all over the world. I wish I had bought some stock in the masks. But unfortunately, no, that is not effective, because the masks only prevent the transmission of large respiratory droplets. And in order to prevent the small droplets, which are usually the most common ones that cause the virus, you really need to wear a special kind of mask called a respirator that's only available in healthcare settings that you need to be fitted for and everything. So, it offers us some mental protection that we're shielding ourselves, but unfortunately, it's not as protective as we would hope.
Well, there's still more questions, I know, than answers, but it's good to talk to you and try and learn more about coronavirus as it continues to have a broader impact. Thanks for visiting with us today.
Thank you, Tom.